For this reason, histologists have studied the epiphyseal plate. The epiphyseal plate is a plate found between the epiphysis, the metaepiphysis and the diaphysis. So this border right here, this small space is responsible for the length, maturation and elongation of the bone. So let's zoom in this structure. Now there are two different types of schools of histologists. Some histologists say that this epiphyseal plate has 5 layers, some say it has 7. To clear everything up, we'll discuss them both in the same time. The logic is the only difference, let's say, is that the last 3 zones are actually the 5th zone for some histologists. We'll discuss the functions and we'll see why this happens, why this classification and why this difference in discussions and opinions exists. Nonetheless, the first 4 stages are identical in all the different classifications. So we have the resting zone, where we actually have osteoblasts and osteocytes inactive in this location, in the upper part of the epiphysis, towards the epiphysis, meaning in this location right here. We start from the outer part from the distal part, the superior part, sorry, to the middle part. So from the superior to the middle. First we have the resting zone, then the proliferative zone, hypertrophic cartilage zone, calcified, and then the 5th, some call it zone of ossification, some have this distinction of line of erosion, osteoid and ossiform. Doesn't matter, we'll discuss them both. So let's start describing each and every one of them in detail. For this reason, I used specifically 3 different pictures and each of these pictures actually show each of the different zones in much more detail and much more, let's say, accuracy. So this is the first I'm going to use, this is the second I'm going to use, and this is the third I'm going to use. Don't get confused, all of these pictures, all 3 pictures actually show the exact same thing. This is just a different section from different location. But in all 3 pictures, we have exactly the same information, and there's exactly the same process happening. All 3 of these slides are actually ossification slides. So let's start. First, we have the zone of the resting cartilage, where we have in the top part of the epiphyseal plate, we have a high quantity of chondroblasts and chondrocytes that typically reside within the lacunae. In this case, in this zone, nothing actually is happening. There is no activity, nothing more than just a typical production of ECM from the cartilage. Just chondrocytes and chondroblasts performing their duties of production of ECM in low activity and in fact even minimal activity. So this zone is actually very easy to identify because it's identical to the typical picture that we saw in hyaline cartilage, where we have the chondroblasts and the chondrocytes in fact residing within the lacunae. So here we have the lacunae, as we can see. There we have the 2 different types of chondroblasts or chondrocytes depending on the degree and the step of differentiation. And this is what we can see. This is the first picture that we can see. In the second, we can actually see, this is again, it's very easy to identify because simply we see the chondrocytes within the empty spaces and residing in the lacunae. Just a fast reminder, the reason why we see these empty spaces is because glycogen was present before the sectioning, before the tissue preparation. In fact, whenever we have this, let's say, low amount of diffusion or low amount of vascular supply within one tissue, within one cell, this cell is going to try its best to stay alive. And this is done in 2 manners. It actually accumulates glycogen in its periphery within the cytoplasm, and the second is to produce vascular growth factors. So then in the beginning we had the resting zone. Again, we said that here we find the chondroblasts and chondrocytes with low amount of activity or minimal, and then we have the zone of proliferation. Exactly beneath it, we're going to have the zone of proliferation. Meaning what? What is the function of this zone? As the name suggests, it's the zone where the mitotic division of the chondroblasts or chondrocytes takes place. So these inactive or minimally active chondroblasts will start to divide, mitotically divide, and produce, of course, more cells of the same, but in this case they're going to be in a column arranged cells. The point of this procedure is to produce more matrix and to practically elongate the pre-existing cartilage. So the first step to ossification is the prolongation and the let's say the elongation of the already existing cartilage. So, and this is where we actually find the zone of proliferation. Let's start seeing these pictures. In fact, again, this zone is very easy to identify because we have many stacked many stacked chondroblasts and chondrocytes in one after the other, in very neatly organized. So again, in this section we can see in fact two layers. We can see the proliferative zone and the resting zone right here. Again, the resting zone is easy to identify because we can see the empty spaces and of course the multiple chondrocytes or chondroblasts residing within the one lacuna itself. Let's move on. So, what happens after this proliferation? Okay, we have the proliferation. But as a consequence, proliferating a tissue which is avascular actually poses the same problem of diffusion, because the more it elongates, the further away it goes from the vessels. Because don't forget, the cartilage again is an avascular tissue. So the vascular supply can be found in the epiphyses on the top. So, as these cells start to proliferate and actually grow and increase the distance from the ossification center where the blood actually supply is given, these cells start to have more difficulties to survive. Meaning what? These cells will start to die, will start to apoptotically will start to die through ischemia. And as I said before, the reaction of a cell always when it's undergoing ischemic necrosis is hypertrophy, production of these vascular growth factors, and then if there's no change, this cell will eventually die, and of course the accumulation of glycogen. So how do we distinguish actually the zone of hypertrophy from the zone of proliferation? Because in both cases we're going to have again the same cells, chondroblasts or chondrocytes. So how do we do this differentiation? The trick here is to see the increased amount of glycogen in the cytoplasm, number one, and number second, we're going to see the size increase. That's why it's actually called hypertrophic zone, because in this case we're going to see these cartilage cells will be much bigger than in the zone of the proliferation. So this is a very clear picture of how this zone of hypertrophy looks like. And again, on this part and right here we can see the zone of proliferation ending, and here we can see the zone of hypertrophy actually starting. Of course, the very important feature that we should again undermine is the production of vascular endothelial growth factor. Why do we care so much? Because this factor is the one actually that will initiate vascular invasion, meaning that because of this increased amount of concentration of this vascular endothelial growth factor, we're going to have the penetration of the vessels and actually will allow for the bone marrow to actually form. So let's move on. Then we have the zone of calcified cartilage. This is the last step where we can actually see alive cartilage cells. The last stage. After this, these calcified cells, these calcified cartilage, and the chondrocytes and chondroblasts will actually die. So in this case, the difference is that again we're going to see the hypertrophic cells, but it's going to be more basophilic because we're going to have increased amount of calcification within this area. So again, we have from the beginning the resting zone. In the resting zone, nothing happens. Then the proliferative zone, where the function is the elongation of the cartilage. As a consequence of this elongation, the next step is the zone of hypertrophic cartilage, is where the cells actually accumulate glycogen, produce vascular endothelial growth factors, and then the last one is the zone of the calcified cartilage, where these cells will actually start dying. And we have the increasing amount of calcification. The reason why it's important to mention and to underline the calcified cartilage is because of this high amount of ECM and high amount of growth factors. This is the perfect scaffold and the perfect matrix on which the osteoblasts and the osteoprogenitor cells will actually start to form and start to aggregate to form this bone. So this is the last position where we can actually find alive chondrocytes. This is the picture of this very nice picture of the zone of calcified cartilage. We can see an empty space, an empty lacunae, no nucleus. This is the trick. This is the easiest way to identify whether we are in the hypertrophic cartilage zone or the zone of the zone of the calcified cartilage. The zone of calcified cartilage practically contains no nuclei because we have the initiation of the death of these cells, of the chondrocytes. So at this point, we're going to have to start discussing the two different, let's say, opinions of histologists. Here we find let's say the group of histologists that actually say that we have the last zone, the ossiform zone, and that's it, the ossification for the zone as it is, and the ones that start saying that, well, we have two more layers within this tissue. So, let's start discussing about actually what we can see histologically, and then we'll discuss the different classification. Nonetheless, in this last zone, the fifth zone, we will see a mixture of three different things. First, we're going to see many osteoclasts. In fact, some histologists call them here chondroclasts because they actually destroy cartilage. Nonetheless, they are the same cells. They are monocytes that are fused together to start to destroy mineralized material. So, in this zone of erosion or line of erosion, we can actually find multi-nucleated cells, typically osteoclasts, that will start to destroy this existing cartilage, this cartilage matrix, to allow for the bone marrow and the bone to expand. So, this is the first step. This is actually a very nice picture that actually illustrates these cells. They're very easy to spot, the osteoclasts, again, because they're multinucleated cells. And typically not many human cells actually contain more than one nucleus within physiological conditions and not pathological. So in this case, we can actually see one very nice cell right here, this osteoclast, second here, third here, and fourth here. The easy way, of course, is to measure the nuclei and to identify the borders of the cytoplasm to find out if this nucleus actually belongs to the same cell or maybe it's an overlap, a typical picture that can actually happen within the histological slides. So then with the other zone we can find, or the other, let's say, content within the fifth or other zone we'll discuss right here, is the osteoid zone. The osteoid zone is nothing more than just little areas of bone, of little areas of deposition of osteoid. Of course, in this case, again, we find these osteoprogenitor cells and osteoblasts encircling the cavity and the pre-existing cartilage matrix, or the remnants of this cartilage matrix, and they will start to produce this osteoid, which will eventually mature into bone. So here, this is the perfect picture actually where you can see the mixture of both. We can see the remnant of the calcified matrix here from the cartilage and the new deposition of osteoid right within here. So these cells again are osteoprogenitor cells, and in fact in these ones within the osteoid will be called the osteocytes eventually, and in the periphery we find the more active osteoblasts. And of course these loci, these locations right here, will start to produce more and more osteoid, and eventually, because of the expansion, will start to fuse to form the more, let's say, to achieve the morphology of the lamellar bone. And specifically here we're going to find, because we're within the bone, the lamellar trabecular bone. So the last zone is the ossiform zone, or the last feature we can see in the fifth zone is the ossiform zone. This is nothing more than just spicules. Spicules mean spicules. This is the spicule, this, let's say, locus of production of osteoid, and this is the last thing that we can actually see. Some histologists again distinct three different layers in this position: the line of erosion, where we can find the osteoclasts; the osteoid zone, where we can find the osteoid; and the ossiform zone, where we can actually find these bony spicules. Nonetheless, the other classification, which honestly I prefer, is the zone of ossification. And of course, this zone is just, we can find these three features within this one zone, and that's it. That's the whole story. So to sum up, here in the first picture that we saw clearly the zone the resting zone. We can clearly see the zone of hypertrophic and proliferation here, if we have to zoom in to find that actually. And then we have the cavity as it is. The second picture that we can actually see here actually illustrates much easier the resting zone, clearly the resting zone. Then we have the proliferative zone, resting zone right here. Then the zone of proliferation should be, one second, this is clearly seen, the zone of proliferation here. Here the zone of proliferation is not that clear, but we can actually clearly see the zone of calcified cartilage. And this is the zone of proliferation, right here. Again, the beginning is resting, then we have the zone of proliferation, then hypertrophic cartilage, then calcified cartilage, and then the last fifth stage. So again, this picture shows clearly the presence of the resting zone. Again, this is the proliferation zone, this is the hypertrophic zone, and this is where we find the empty spaces and the empty loci. This is the zone of the calcified cartilage. And actually a nice idea here is to see both of these processes in the face of the human embryo. Again, as I said before in the beginning, the mandible is the one organ that actually combines both methods to produce the mandible, the bone itself. So if we zoom in within the mandible, which is right here in this location, we can actually start to see both of these formations, both of these ossifications take place. So let's zoom in. This is in fact the picture that I used for the presentation exactly. So here we can see clearly the hyaline cartilage cut in cross section, and here we can see the intramembranous ossification taking place. This is the immature bone. This happened again from the aggregation of mesenchymal stem cells, the nidus, the expansion of these nidi, and then the fusion of these spaces. And here we can actually see the typical formation, the typical, let's say, appearance of the hyaline cartilage in the cross section. So again, let's start seeing more detailedly. These are the three pictures that I used for the description of the different phases and the different zones of the endochondral ossification. So if we zoom in here, let's start zooming in. Here we can clearly, let it focus, we can clearly see the resting zone right here. This is just the reserved cartilage as it is, the hyaline cartilage as it is. Here we start having this zone of proliferation, but because of the section we cannot see it in parallel arrangement, but we can actually see the increasing amount of chondroblasts and chondrocytes in this location, and eventually we can see the zone of hypertrophy right here much clearly. Second, this is the zone of hypertrophy where we can still see the nuclei, and the last one is the zone of the calcified cartilage where we can actually see no nuclei present. Here the chondrocytes are actually dead, so all we can actually see is this empty lacuna as it was, along with the high amount of ECM and matrix surrounding this lacuna. And then of course we have the zone of production, the zone of the ossification. So in this case here we can see the of course this is just nothing more than vessels. Of course this area is highly vascularized because we need an increasing amount of energy and of course minerals, oxygen and nutrients. So in this location we can find the three different characteristics. So let's try to find, for example, this is the start that here we have the initiation and the production of the osteoid. So we find osteoblasts in the periphery, and of course in the center we start to have the production of the osteoid, which will eventually which will eventually form the immature woven bone, and eventually through time it will differentiate into the mature bone. We discussed how the immature bone grows again and practically matures into the mature bone, the lamellar bone. And in short, this is a procedure that actually happens through the bone resorption and the production of new osteoid from the beginning. So let's start seeing this other section so we can focus on clearer and different areas. So again, I'm zooming in. Just a short recap. This is the epiphyseal plate again, and this is the diaphysis. This is where the actual blood supply comes from, the ossification center right here, and the second is from the center of the diaphysis. So let's zoom in here. In this section, we can actually find the easily and clearly the resting zone right here. It's right here, the resting zone, where we find the inactive or minimally active chondroblasts and chondrocytes. This is the proliferative zone, where we can find clearly the rows and the columns of the chondrocytes and the chondroblasts mitotically dividing actively. And here, this is the trick, guys. Because of this mitotic division, because of this elongation of the matrix, this is how our bones can actually elongate. Because one question that could be asked is, well, how? We have the proliferation at one point and the resorption from the bottom. So the diaphysis actually destroys, through the osteoclast destroys the cartilage, and that one produces it. So how do we have the actually the increase of the length? How does the length increase? Well, simply because the rate of the production and the proliferation in the proliferative zone is higher than the rate of resorption coming from the diaphysis. In fact, this is how we can distinguish in orthopedic surgery, and of course, and this is how we can estimate the bone age of a person. If we see that there is still cartilage in the epiphyseal plate, then we can safely say that this person is still growing and the length of the bone is still increasing. If in the x-ray we can start to see simply the fusion of this line and there is no epiphyseal plate, then we can safely say that this person no longer grows and his bone maturation and bone elongation has been completely completed and fulfilled. So again, the rate of production, the proliferative zone is right here in the columns, easily seen. Then we have the zone of hypertrophy. And again, the difference between hypertrophic cartilage and calcified cartilage is the presence of nuclei. So of course here the hypertrophy, we can see an enlarged space, an enlarged chondrocyte, and eventually we have the death. Here maybe we can see the tiny space of the calcified cartilage. But the calcified cartilage is actually much more easily seen in this section here, in this picture. Clearly we can see the calcified cartilage right here because we have the empty spaces and no nuclei present. But again, this picture can clearly demonstrate proliferation, hypertrophy zone, and then lastly the line of erosion and the zone of ossification.